Referred pain is such a silly concept if you think about it, and I've been working on my tactic to explain what that is to patients. And sciatica is usually a good place to start, where I could say, hey, you know how people will say, oh, I have lower back issues, but when they complain about it, it could be anywhere from their leg to their hip to their knee to their foot, and it's a sharp sensation and it goes places other than their back. And the patient will be like, oh, yeah, I know, like my granddad. And I'll be like, yeah, that's what referred pain kind of gets at. Because I've seen patients who have had laparoscopic procedures where their belly gets blown up full of air so that they can move their instruments around and surgerize or whatever. And they come back with shoulder pain, but sometimes people are like, it's going to my left shoulder and it's kind of sore and it's going down my, am I having a cardiac event? Now, that warrants a cardiac workup in a vast majority of cases where people are old or have comorbidities, whatever, right? A 20-year-old person who had a laparoscopic, like a diagnostic lap to find endometriosis, might not require a cardiac workup. Patients are different, whatever, you get the point. But when you finish your workup, they could still be in pretty significant discomfort, and you say, hey, like your discomfort is real. This is what it is not, right? It's not pneumonia or a pneumothorax or a PE or a dissection or ACS or whatever is in your differential, right? So that's more that population of patients. Another one is referred pain from testicles in younger people. And if you have a peds patient or a teenager or a young adult and they're there with their girlfriend or their brother or their partner or their whatever, and it's kind of an uncomfortable conversation, I will usually preface with, there's a reason why I'm asking this, because your whole workup will be different. Do you have pain that radiates down towards your testicles or your scrotum? Because you never want to be that doc who misses testicular torsion because you assume everyone is an API rule out. That's why, regardless of who's in the room or family, if there are certain sensitive questions that might be impacted by who is in the room, kick them out. Just say, oh, this is just a standard thing for every adult or every teenager or every whatever. Like, these are conversations I ask one-on-one with the patient. Because you will have that 20-year-old dude bro guy coming from a frat party saying, no, it's like my appendix, I think I got a fever, whatever. And then you kick their buddies out of the room and they're like, yeah, my testicles have really hurt for like 12 hours. I was so embarrassed. They would rather quite literally lose a nut than be honest with a doctor. And it's important to recognize that people can do that. So that's the general tone that I take into referred pain.